that they actually enrich my own life. And that's pretty sweet thing to come to work each day and be able to do. So that's number one. In terms of why I ran, a few reasons. So the reason why I'm running for Assembly in District 36 is because I noticed that there were several issues that I was actually very passionate about that maybe weren't getting the press and attention that I thought that those issues really deserved. One, as you can guess, is mental health and mental health care, as well as access to primary care services. So as veterans, you all know the importance and the value of adequate and more than adequate mental health care. And it's very tough when you or I or anyone is in crisis, and we feel like we don't have access to that timely mental health treatment that we all deserve. And so that was one of the big reasons. In your population, specifically in the veteran population, the statistics show that mental health crises, they just tend to be more common and they tend to be more untreated. Because in the global, larger population, mental health has such a significant stigma, and it's tough to sort of combat that stigma, if you will. When I have veterans that I treat in the inpatient setting in the hospitals, one of the frequent things that they mention in terms of why they didn't get treatment quickly enough is because mental health and having mental health issues is quite stigmatized, and it's seen as a sign of weakness. And if we keep quiet and we allow these crises to happen without casting some voices onto them, then we're not helping to solve the problem in any way, shape, or form, right? It's one of those things that's very tough because of the stigma, and that makes it very hard to treat. But all of us, I believe, need to sort of bind together and collaborate with each other and listen to each other in order to solve some of those issues. And so that was one of the pain points that I wanted to touch on. Now, what I've noticed in your population, and again, I am not going to claim to be any source of an expert at your population because your experience is completely your own. I can only go from my experience. And my experience in working with and treating veterans on a daily basis. It feels like transportation has been quite a barrier in getting timely access to primary and mental health care. Living out here in Pahrump, if you're in, God forbid, but if someone ends up in crisis at 2 or 3 in the morning and they have had a very difficult day, can we really expect that they have the resources to get themselves safely into the custody of mental health treatment in a hospital? We just can't expect that. And the truth is that our EDs, our hospitals, and our law enforcement are very overwhelmed. And the number one way or manner in which veterans get health care in the mental health setting is through, unfortunately, law enforcement. And so that's not okay. We have stretched the system and we're not achieving solutions that we need. So that was one of the big points. Another one is the isolation. Especially here, when people, in some cases are living on 1, even more acres. It's very tough to not have the support that we need at the times that we need it. And sometimes asking for help feels like, it makes us feel like we're weak. But the reality is that being vulnerable sometimes is actually, in the long run, going to be the most helpful, especially if one of us, again, God forbid, ends up in a mental health crisis. So these are some of the pain points, some of the issues that I noticed among the veteran population specifically. Now, what do we do to solve them? Just very briefly, because I don't want to take too much of your time. A couple of things. First of all, what I've noticed is very helpful in the hospital is this battle buddies concept. So if someone has a mental health crisis, they frequently rely on their comrades that they've served with to sort of help get them through it. So we have specific visitation hours specifically for those individuals, and we need to better incentivize them. So we need to ensure that they have access to that there's no breakdown in the isolation and communication to make sure that when a veteran is at quote unquote their worst in their time of crisis, that they are presented with someone familiar to them that can actually care for them, that can shake their hand, that can guide them through it. That we specifically have times reserved in all the hospitals for this purpose. That's very important. I also think a central scheduling system for transportation and getting to appointments in places outside of Pahrump, for instance, which is a big barrier to get healthcare access, is another really no-brainer, something that we need to do and collaborate on together with our state or legislative officials. And I also think that it's very feasible to have a non-911 crisis helpline, again, that we fund, which would allow people, maybe they're not totally in crisis, maybe they just had a really bad day and they're not doing well and they're isolated. So that doesn't necessarily mean they need to call 911, but we have a provider, a clinician, as well as a first responder that's trained to help deal with some of these emergencies before they become worsened emergencies. And so those are some of the big things that I wanted to kind of address. And again, this is really just the tip of the iceberg. My goal is really to learn from you and not to sort of push anything, but to sort of use my empathy, which I think is an important trait for all of us, to listen. And so again, you know, I hope that in this opportunity I can sort of learn from you, and I wanted to also use it to introduce myself and my mother. So again, I'm Dr. John Pangenejo. That's my mom, Nadia Genejo, and we're both here to lend our support. And again, thank you so much for letting us talk, Commander Samuel. Thank you so much.
You're certainly welcome.
I appreciate it. Thank you.
Anybody have any quick
Yeah,
questions
please, if you have
for
any
him?
questions, please let me know.
Okay.
All right, thank you
Yeah,
so
how
much.
do you spell your name, sir?
Ooh, okay. So the first name is really, so John is obviously very easy. The last name is the month of June and then J-O. So it would probably be easier if I said Junjo, but Junejo is the correct. So I'm gonna, yeah.
Well,
pronounce it
Thank
right.
you.
Thank you so much.
Oh,
Yeah,
yes.
please, please.
You get these people in a group, is that it? When do you usually have this? Do you have like a schedule for them to go to?
For whom specifically?
Pardon me?
For whom specifically is
For
scheduled
the
for?
veterans, when they wanna talk to one another, do you get a group of them together, or how do you work that out?
We coordinate with a commander. So basically, someone gets admitted to our hospitals. They're in crisis, obviously. We're in very close contact with a commander, and we talk to them in terms of, is someone available from their unit that can actually come down and talk to them. We also have like a chaplain that's there as well. And so the biggest thing that we do at that point is arrange some group therapy. So we have someone that may not have gotten into the hospital quickly enough because of the stigma, and also it's very hard in the military to get in. So
Okay.
now we have someone that's familiar, they're sitting with them, and we get many of them in a group, and they're having group therapy with each other.
Okay, do they have to be in crisis to join this group, or they?
Well, in the hospitals, typically, yes.
I see.
And so, but I will say this, that battle buddy that came in for support, to support their, you know, fellow comrade, in this battle, if, God forbid, they end up in a similar crisis, now they're more likely to come into the hospital a little bit sooner, because we're helping break down some of that stigma of having a mental health crisis.
Okay, so you can get a battle buddy, like
Yes.
any one of these men, to
Yes.
join your group, to come
Yes.
in and help these people that are in crisis.
Correct,
Like, in other words, I could tell him, join your group to help other people.
correct.
Okay,
All right.
so how do they do that?
Well, that's a good question. So I would say that, so I work at a few different hospitals, and the process is a little bit different in each one. I think the goal, and this brings to the form that we don't have a crisis and stabilization center for mental health in Pahrump. Okay, that's priority number one, because we can't rely on, it's hard enough for the individual in crisis, the veteran in crisis, to come to, for instance, Clark County to get help. That is very unrealistic, especially if they're in crisis. So we need to make sure that we can draw from within, and that would entail initiating a crisis and stabilization facility right here in Pahrump, where people need it.
Okay, I have a question for you. This is actually not a question.
Okay.
It's more of a request for
Okay.
you. There's a few people in here. We
Yeah.
are trying to get a veterans center done here in Pahrump. We're trying to get all the veteran organizations here in this town to one location. Okay, we've been meeting the second Friday of the first Friday of every month at the Valley Electric, but next month in May, we can't get it. What you ought to do.
Second Friday,
What's that?
second Friday.
Second Friday, but now for May, we can't do that For May, we're scheduled for May 19th at 10 a.m. at Valley Electric. Because we can't meet in on the Fridays because they're all booked in May.
Hmm.
So what we have down here, if you're available and you want to put it on your list, we're having a meeting on the May 19th, which is a Tuesday, at 10 o'clock in the morning at Valley Electric.
Okay.
And we have organizations come, some have come from Vegas, as well as what's here in Pahrump. We're trying to get together, and they've been talking about mental health and everything else, so
Okay.
it might be good for you to come there and speak to them people, and as well as have your input put in to these people, then, you know, you can, with you running for a particular office,
Mhm.
it's gonna help your campaign in a way where you get behind this thing that we're trying to do here in town, which would go a long way for you. I think you really would, because we need somebody on board
Yeah.
to help us, you know, get this thing off the ground.
I think more than the campaign, what would be most helpful is exactly what you said. It's actually be in a room
Right.
with people where I can, again, draw from their experience and learn, and then also, like you said, put some of that input.
Right, because
That's something-
that particular day, we have the VFWs there, the
Yeah.
American Legion, we have the Elks, the DAVs there.
Yeah,
All the organizations for here in the town, we have the Nevada Outreach,
yeah.
we have the VA Hospital, so, like, people come there, we're trying to get this thing off the ground. So we even have a woman who comes from Henderson, she's with the Vet Center in Henderson,
Mhm.
and she's coming up here to mentor us to how to do this thing properly.
Okay.
So, you know, it would be a good thing, you know, for you to, like I said, if you're free.
Yeah, I'm free.
Okay.
Let's do it.
Okay, all right.
Well,
Yes, please.
I always have a lot of
No, no,
questions.
you're good.
Always a lot of questions. Are there a lot of men out here that go into crisis, that there are? You just said yes.
Yeah, all right.
I think that there's more than I was pretty surprised to see how many, not only veterans, but also active duty men and women, that have developed the courage to come in a little bit quicker just because they've seen someone else go through crisis.
Well,
And-
also you have the fact that the military is really pushing it. When we're coming back at Iraq and Afghanistan, back in '07,
Yeah,
and about '06, '07, you had generals and sergeant majors going public on the AFN, which is Armed Forces Network, and standing up and saying, I'm getting help,
yeah,
to take away the stigma. Because when I started my career early in the late '70s, that was the fastest way out of the military. Was you had a sex problem, you were done.
yeah,
You know, so you went and got help on your own and paid out of your pocket. Whereas you got generals and officers, other officers and high-level NCOs, but primarily sergeant majors, were putting the stigma, hey, if there's a stigma, look at me.
right. So again, I know I'm taking up a lot of your time, and I apologize for that, but I would just say very quickly, I do have experience at working at Fort Huachuca
Okay.
in Sierra Vista in Arizona.
Oh, yeah.
And over there, our biggest priority is to try to keep folks in service. So we try to give them with as many resources as we can, but the most productive thing we do is to have direct contact with the command as frequently as possible. And honestly, they typically have the final say of when the patient is discharged. So we care that much about their input because they know them a lot more than we do in that short amount of time that we spend with them. But again, the biggest priority for us is to try to intervene before it gets to the crisis stage as well.
And when were you at Huachuca?
I mean, I'm still there once in a while, but I've been there
When
for
was
the
the
past
earliest
couple of
time you
years.
were there?
Yeah.
When was the earliest time you were there?
Ooh, 2024? Yeah.
That's my home.
Okay. All right. Sierra Vista, yeah.
Okay.
Well, thanks so much, and please feel free to just come find me offline as well to have any other discussions. Happy to do it. Again, thank you so much.
Appreciate you.
Thank you. All right, I appreciate it. Thank you.
Make sure
Can you sign our roster back there, please?